ahead and just do a squat for me, and I just want you to, good, and that looks good. All right, come back up, and if you can see, do you see how right away she turns that right foot out without even anybody saying anything? So go ahead and do one more for us. Get your feet straight to start, and that's a little bit better. But even now, you can see it starts to try to turn out. So one thing we always want to think about when we're looking at athletes like this is, what's the source? And she's obviously had a recent injury to her ankle, but I think one, we need to look at, well, what's her ankle dorsiflexion range, or how far she can bend her toe back. The other thing we really need to look at is hip range. So, and hip cueing, and whether or not she's cueing that external rotation of the hip. So Abby, if you can, come down here to that step, and I want to show you an exercise, and I'm actually going to have you hold it for me first, and I'm just going to kind of show it. So one thing we want to concentrate when we're looking at this is, as you can see when she's here, and when she's doing the squat, she's having a hard time shoving those knees out. That foot wants to drop. She's doing a poor job of creating a supinated or stable foot. And what that does is that really causes a problem with her hip, and that she's lacking internal rotation there, so she's making up for it by giving in at the knee and then into the ankle. So if we look here, so Abby, if you can see my foot here, what I'm going to have her do is she's going to cue some dorsiflexion, just some mobilization into dorsiflexion, and then what I'm going to have her do is externally rotate her, turn that foot out. So I'm squeezing my butt, I'm externally rotating that, and I'm creating a stable environment, a stable foot, while I'm in that dorsiflexion, or that restricted range of mobility. So ideally, you're going to hang out here. Minimal therapeutic dose, as we talk, they talk about on Mobility WOD and other places, is 2 minutes to really get some tissue elongation. So Abby, go ahead and try this, and then we'll see how your squat looks. And you can see how much she wants to give in at the midfoot right there. So Abby, if you can, try to get your heel up closer to the edge. There you go. Okay, now don't give in at the hip, so keep a nice, stable, flat back. And now what I want you to do is just try to turn that hip out. And go ahead and just rotate that thing out against your foot. And you can see how difficult this is. So one of the things I like about this exercise or mobilization, whatever you really want to call it, is that she's doing two things at once. One, we're mobilizing in the position of restriction. Two, we're cueing external rotation into that position. So just hit this for a few more seconds, and we'll try it even then. Just see how it feels. All right. Okay, good. And then come back up here, and then Abby, just go ahead and give us another squat. Yep. So shove those knees out. Good. How's that feel?
Better.
Yeah.
Easier.
And what's that?
Easier.
Yeah. And what you can see here is, go ahead and point your feet forward straight again. All right, and then do one more squat for us. Good. And as you can see, come back up. Look, that foot does not want to cheat out nearly as much. So she's able to create that active, external rotation, active, stable arch of her foot. All right? So she can crush it at, what school are you going to?
Belmont Abbey.
Belmont Abbey. Abby's gonna crush it at Belmont Abbey. All right, we'll talk to you later.